Well, back to men and another men's issues. Love handles on a guy.
Yes.
Yeah, let's talk about
If you reduce the love handle, Bob.
Do they come back?
This is what happens. The idea of liposuction is not to treat someone who's generally overweight and proportionally overweight. It's really to treat isolated contour deformities like the love handle, the outer thighs. If you can look at yourself in a mirror and see a spot or two spots, that's what it's good for. So if you do just the love handles and you put a man or woman into better proportion, should they lose or gain weight, hopefully they'll lose or gain maintaining that proportion. However, if you take someone who's struggling with their weight and they're kind of heavy all over, and they just say, please do my abdomen, and you do their tummy really aggressively, and then they continue to eat and ingest more calories than they burn, then they will store those calories elsewhere, but now the abdomen has less of an ability to store those fats.
Less cells in it.
Because there are less cells. I should have said that. That's exactly right. There are fewer cells now in the abdomen, so you proportionally put fat elsewhere. So when you hear people say, well, when you get liposuction, it goes elsewhere, in properly selected patients where you're treating an irregularity of contour, that's not a problem. But if you're trying to use it as a substitute for dieting and actually losing weight, then you get that problem.
Well, and you get a bulge somewhere else, and maybe it won't be a place that you want it either.
Exactly,
right?
that's correct.
I have a question about that. Let me just ask this because this is for your health. If you have love handles, if you're a guy and you have it lipoed, are you less likely to have heart problems? Because isn't it true that if you have carrying a lot of fat around the midriff, you can end up with other complications? Is that going to help you?
Several years ago, there was a lot of thought that liposuction could be helpful for heart disease and for the development of diabetes. There's been some conflicting data about it, but the preponderance of data today is that there is no health benefit to liposuction. 10 years from now, we'll know more, but no one should do it today thinking that it will give them some benefit. It's a good question, but not yet borne out by any research.
Okay.
Is most of your surgery done on an outpatient basis?
Yes.
In your office or your surgical suite?
Yes, we have a fully accredited, licensed operating room in the office.
And what the typical surgery is, are people under general anesthesiology?
Most of the time I use general anesthesia.
Okay. Okay.
The idea is to make it as comfortable as possible for the patient. And today the general anesthetic drugs are so good and so improved that with general anesthesia you actually can put someone to sleep quicker and wake them up quicker oftentimes than you can just by giving them IV sedation. It's up to the choice of the surgeon, the patient, and the anesthesiologist. And the three of us talk for each patient, but more often than not we choose to use a general anesthetic.
We talked just a minute about a female issue, which is breast implants. I imagine you see women who want to have enlargements just because they wish to do it as electively, but you also see people who've had perhaps need reconstructive surgery. In these cases, what are you recommending that women do? Is it silicone? Is it saline? I mean, there's such a big debate out there about what's going on and what's safe.
All right. Unfortunately, in the United States in 1992, FDA Commissioner David Kessler decided to put a moratorium on silicone gel breast implants, which we've enjoyed now for 13 years in the United States, during which time women are, and today, can still only get saline implants when they have their surgery, unless they're having a reconstruction. So the cancer patient who's had to have her breast removed, she today is allowed to get silicone. A person who is having a revision of an earlier saline implant can get silicone. But a first-time pure augmentation can only get saline right now in the United States.
Can you explain the logic of that, Steve?
There are a lot of people who don't think that there's logic. This is what it goes to. Silicone gel breast implants have been used since the early 1960s. It wasn't until 1976 that the FDA was charged with regulating devices. Before that, they just regulated drugs. In the early 1990s, there were a rash of laws with huge plaintiff awards alleging a link between the breast implants and a disease. At that time, implant manufacturers did not have enough data to show that they were safe.
That's
But
Dow
today,
Corning, right?
That's correct. They were one of about 16 manufacturers. But now the data is conclusive that there's no association at all whatsoever between silicone gel breast implants and any of those diseases, all right? But that's why they took them off the market, because they didn't have the data then. We have the data now, and recently an FDA advisory panel has recommended to the general FDA to reintroduce silicone breast implants, which would be great for women because they're softer, they look better, they're much more lifelike, and we can join the other civilized nations of the world to again be offering them to our women.
What about using human fat? I was taking a little lipo from somewhere else and using it in breast enhancement.
Problem with that are two. One is that most of it gets absorbed, and the second is that it can calcify and it can confuse mammograms. As a matter of fact, that's specifically an exclusion in my malpractice. I'm not even allowed to do it because the procedure is so worrisome about what it does to mammograms.
Steve, would you deal with the subject of ethics in your business?
We have about 3 minutes.
I know you're involved in that and you're concerned about that. What's the oversight for plastic surgeons within your peer group?
Well, we have both the California Society of Plastic Surgeons at a state level has an ethics committee, and then the national bodies, the American Society of Plastic Surgeons and the American Society of Aesthetic Plastic Surgeons, each have regular meetings of ethics committees that look at our members and make sure that they abide by our very strict ethical guidelines. And it's not often that we have problems, but there are problems that occur, obviously, from time to time. And then also in California, we have the State Medical Board, and they look at us to make sure that things are continually being done.
Is it difficult for other specialties in medicine to become members of the Board of Plastic Surgeons?
It's very difficult to become a member of the American Board of Plastic Surgery. Most people think of plastic surgeons as plasticky and superficial and makeup and just a little bit more involved in having your hair done. But in fact, I'm fully board certified in general surgery. I did 5 years, including cardiac surgery, neurosurgery, thoracic surgery, abdominal surgery, and then I did an additional 2 years of training in plastic surgery, and that's what's typical of what we call real plastic surgeons. But your medical license, when the state gives a doctor a medical license, it is a license to practice medicine. The state has not made it their interest to make your license specific to your training.
True with lawyers, too, right.
That's correct.
So if you're board certified, you've taken an extra step under
Correct.
some review.
See, at St. John's Hospital, and any hospital, if you want to do heart surgery, you have to go through the Hospital Credentials Committee, and they're not going to let you, in their hospital building, do open heart surgery unless you're board certified as a cardiothoracic surgeon. And to do plastic surgery at St. John's Hospital, you have to be board certified in plastic surgery. But in your own office, where there's no such oversight. And so we have a rash of non-board certified plastic surgeons in this community and throughout the country who attempt to do plastic surgery without any appropriate training.
Do you have a website or some way, people are going to want to, we're about at the end of our time, they're going to want to get in touch with you. I think it's fascinating.
Dr. Teitelbaum, Dr. Teitelbaum, Teitelbaum.com, and there's some information there that may be helpful to some people.
And how about a phone number for those who don't have?
It's on the website.
It's on the website, okay,
Yeah.
great.
It's been great talking with you. Thank you so much.
It's an honor to meet you.
Thank you,
My
Mr.
hero
Steve.
from childhood.
Thank you for having such a great memory from so long ago.
You're a great player.
Bob,
Yeah.
talk with him about your nose. I like your nose.
Thank you. I won't do a thing with it after the show.
All right, we're going to have our next guest on. We get to see Buster. Really excited about that. Booster?
Booster.
Brewster. I'm so excited. I can't remember
Be right
his
back
name.
with the next segment of Coffee Break. See ya.